Yeah, so it's actually some good news this week, which makes a nice change. I think last time I spoke to you, because I was on leave last week, it was slightly doom and gloom. But yeah, if we just have the next slide and the one after that as well, thank you, and the one after that. Yeah, so you can see this is a slide that I show you, and you can see that those numbers are still going down, are going down. I think they'd slightly plateaued last time I spoke to you, and we had the dubious privilege of being the second highest rate of COVID infection in the country. And I think I explained we know why we've got enduring transmission rates, because of all sorts of things like working practices, etc. But we weren't really sure why we were then up above other areas. But in my absence, the team have done a fantastic job, and the numbers have really come down. So if we have the next slide, please. Yeah, so you can see that the position that we've put out this week is 77.5 per 100,000, and you can see that puts us kind of middle of the pack really in terms of West Yorkshire. That's a huge reduction of 29. I think that's a percentage, yeah, from 27% in a sort of 2-week period. And I've looked at the data, the sort of hot off the press data today, and although that's not validated, we've gone down to 47. So we're still seeing that drop day on day. So I think one of the sort of take home messages is, with COVID being relatively new virus, we're still learning, and there are still some sort of slight mysteries. But anyway, good to see that we're in this sort of improving position. So if we go on to the next slide, and sorry, just one more thing on that, the positivity rate you can see is really low, so 3.8%, so that's fantastic. So that means that for every 100 tests we send off, less than 4 come back as positive. So that implies that we are doing enough testing, but also that we do have those lower levels in our population. I mean, obviously it's still too high, so I don't want anyone to be complacent, but it's a relief to see it going in the right direction for Wakefield district. And we just show you this really just to give you a bit of background about lateral flow tests, which are the tests you do for people who don't have symptoms, and various groups of people are doing these tests twice a week. And you can see that we are getting quite fluctuating rates per week. And what they found in other areas is that at first people are very keen to do the lateral flow test, but over time, and I guess particularly as infection rates fall, there's lower take up. Now, I've shared with you that the challenge around lateral flow tests is they're not 100% accurate. However, they can form a useful tool in our toolkit around fighting infection. And certainly we have picked up some cases through lateral flow tests that we wouldn't have otherwise picked up. So I think at this stage we would still be encouraging people to do lateral flow tests sort of where appropriate. So just to talk a bit about age rate, sorry, this is it's a bit small on your screens, but I'll talk you through it. So, as you know, really anxious. We've been quite anxious about that older age group, but due to the very successful vaccination campaign we've had, those numbers have gone right down. And you can see there, I think the most recent is 36 per 100,000 in that 80 plus age range. So that's brilliant, particularly when you consider that the vaccination is probably slightly less, the older you are, it's probably slightly less effective. So really, really great to see that. And then you can still see, as you go down the table, you can see there is still that bigger, higher numbers in that kind of working age population. Those people won't have accessed the vaccine yet. And what we've seen with the vaccine campaign is that it's been very effective at reducing admissions and deaths, but not particularly at reducing transmission. And that's because that older age group aren't the people that are transmitting the virus. We're seeing that being transmitted much more in our working age population. So as we start vaccinating lower end of age groups, we will start hopefully to see those numbers fall far more quickly, and that obviously will be, again, really, really good for us, for all of us. So again, we always look at the common exposures, and although we can't say it's a cause, we can't say that just because you were in a healthcare setting that caused your COVID, it just shows us relationships that are happening. And again, so sorry, quite small on the slide, but the bubbles, essentially, the bigger the bubble, the more people have identified that as a common exposure setting. So we've got, there are a few, you'll know we did have some issues with the prisons in Wakefield, and you can see that big bubble on the left-hand side. That was quite a big issue a few weeks ago, not a big issue now. So we're still, you'd expect to see the ones in education, because lots and lots of testing is taking place. you can see the bottom bubble, which is workplace, is still quite high. So again, that's kind of what we expect. And you know, we would hope that as the vaccination campaign progresses through our age cohorts, that we would see that one reducing right down. So this is really, really good news, this slide. And you know, it's pretty self-explanatory. It's what the number of people that are in a bed in mid Yorkshire, and you can see that the most recent data, we just have 21 Wakefield residents and 30 non-Wakefield residents that are taking up a bed in terms of COVID. And you know, those patients, we know that people can be in hospital for a really long time with COVID. So some of those patients will reflect the fact they will have been infected a month, potentially even a couple of months, well, yeah, maybe as much as up to 2 months ago, and they're still in that bed. So we should continue to see that reduce. But obviously, those low numbers have taken a lot of pressure off the health and social care system. So that's really what we are very happy to see that. And then again with death, so again, you know, we would never want to, every death, it has a huge impact on family and community, and we'd never want to sort of minimise that. But, you know, you can see on the far left of the graph, those very, very high rates we were having sort of in I think that's even, yeah, I think just looking at the bottom there, that was sort of April. So, you know, hang on, yeah, April 2020, and you can see that, you know, last year, you'll remember it was really horrendous during that the first real wave of COVID that came into the country, and you can see that we've had that fluctuating death rate very much based on infection rates within our population, but now that's come right down. And I think last week we only had one death, and then the most recent week still incomplete because it just takes a while for all that data to come in because it has to be registered. But again, a very sort of positive picture compared to how we were a few weeks ago. So again, and this is like, again, a changing picture every day as we up our vaccinations, but this was the most, I think this is probably about a week old, this data, and showing you that that nearly 60% of Wakefield residents 16 and over have had at least one COVID vaccine. And when you consider that really we're only just starting to roll it out now to the under 50 age cohorts, that is incredibly impressive. Again, sort of middle of the pack in terms of where we're at now. You know, what we're seeing when we look at all of the data is that those members of the public that live in more deprived areas or are classified as more deprived are having lower take up of the vaccine, but still very reasonable take up. I mean, if you know, some of the numbers are sort of in 97%, which is just unbelievable. We've never had a vaccine campaign that successful. So it's a good news story. But I think from a community champions perspective, obviously it would be fantastic if you can continue to really encourage people, you know, we've had some training about addressing concerns, listening to people, but just really continuing to encourage that vaccine uptake, because that's our best chance really. And you of everyone has seen that data week after week after week, and you've seen how the numbers have reduced so significantly in those age groups where they've had a widespread take up of the vaccine. So it is a very effective, well, it's our most effective intervention. Yeah, so I don't know if anyone's got any questions, or whether we'll perhaps take questions. I think I can see something in the chat. Any questions on kind of the data or the general picture? I'm happy if you either type into the chat a comment or something or anything. So generally, I mean, just the other thing to say is I think it's been fairly, Wakefield residents have been pretty good at sort of keeping to the rules, and despite lockdown being lifted, things have been relatively quiet as well. So anyway, I'll finish there if there's no questions and hand on to my next presenter.
Yeah, I'll just do a very quick one as a follow-up to Anna's information. This slide just shows the overall vaccination rate across Wakefield. So as Anna said, we are doing very well in terms of the vaccination programme. You can see that almost 180,000 people have been vaccinated. We are offering jabs to anyone within the 9 priority groups, and we are, as you know, the vaccination programme is open for those over 45. It also gives you the information in terms of second doses. Over 44,000 people have had their second dose, and there is a big emphasis on making sure that we follow up for following people for second doses. And that is information that is correct roughly at 15th of April. So just to say, clinics are still running very much and the programme is going at pace.
Thanks very much, Joshua. And just a quick reminder that if you do want some additional information on how to talk to people about vaccinations, I put a link in the chat bar. There is training available free online tomorrow and next week, and then there will be releasing some further dates in the next week or so going forward, and that is open to people in the region as well, not just people in Wakefield. Thank you. So there's just a quick question from Lindsay around people who are a bit more wary of the second dose, to get their second dose of vaccination. Questions around the contraceptive pill and the kind of risk of blood clot. So any new infographics would be really welcome. And Lindsay, I think there are some available. I think we'll look to share them. I don't know if you want to come in and answer that question broadly at the moment, just before we move on to lateral flow.
Yeah, I was just pasting the link in, which is a good source of information for the COVID vaccine and blood clots, and outlining, sort of helping people to understand the risk of blood clots, which is extremely low, because this is a very rare blood clot condition, and particularly the risk of having COVID or having severe illness or hospitalization associated with COVID far outweighs the risk of someone potentially having a blood clot from receiving the AstraZeneca vaccination. And we do know that the guidance has changed recently to say that those that are under the age of 30, it's a real trick, because you're not as at risk of the disease and the severity of illness for COVID, but you still have a risk of COVID. And sort of the balance of that risk outweighing the benefit of the vaccine is variable. So for those that are under 30, the recommendation was made that they will be offered another type of COVID vaccination, not the AstraZeneca vaccination. So for those under age 30, that's likely to be the Pfizer or the Moderna vaccine, because they're the two other vaccine brands in circulation.
Thanks, Emma. Thanks for that. Okay, so Leslie, over to you. You're very welcome. Thank you for joining us today. Would you like to talk to us about your perspective, please, and what you want to ask of us?
Yes, thanks ever so much for the invite and letting me sort of gate crash things. I mean, that was a really comprehensive pull together of where you are with rates and hospitalizations, and specifically also the look at where you might still find infection rates particularly stubborn. And that's really what we have been working for the last few months to look at. I'm a senior health producer for BBC Network News, so I work predominantly with programs like the Today programme and 5 Live online, and the television bulletins, the 1, the 6 and the 10 o'clock news, as well as breakfast news. And we did a piece about 2 or 3 months ago, I think it was now, really, with Ben Anderson, who is Anna's colleague over in Rotherham. And we were looking at why Yorkshire seems particularly a bit stubborn with some of the pockets, the areas of rates. And it's not a thing, I want to say now, it's not a finger pointing exercise. It's not to say that Rotherham, Wakefield, Hull, all the places, Barnsley, Sheffield, Leeds, all the places that I've been speaking to in the last 3 months is doing it any different to anywhere else. But I think Anna has hinted at this, certainly just now, but also in the past. It's part of the legacy of what makes you Wakefield, exactly like it is with Sheffield and Rotherham. It's part of the industry, it's part of the way that society's been set up there. So a lot of people go out to work. They can't do working from home, they might be working in frontline industries, they might be manufacturing, they might be going into retail. So that's what people do. So we wanted to have another look really before, after the local elections, because we're finding it difficult engaging with certain parts of the government because of the election period. So we were looking to sort of talk to some people in the next couple of weeks to put a piece out for the middle of May, really. And it's looking at the really crucial work that's been done by Anna and her team, the work that's being done by the community champions to get messaging like, get your vaccine, don't worry about the AstraZeneca blood clots. That was a story I was working on 2 weeks ago. It really is, you know, a minimal risk compared to what happens if you don't have the vaccine. But we wanted to do some messaging about what people there are doing. So we're going to be talking to the GP service about dropping lateral flow tests off for people, which I think is a really fantastic initiative, which I've not seen far and wide at all across the north. We're going to be talking to Anna's team about the sort of work that they're doing, finding little pockets of infection and seeing what more messaging can be given to workplaces or wherever the problem seems to be. But I just wanted to talk to the champions really, because you're going to be my connection hopefully to families and people, and those people that do fall into that sort of category of having to go out to work. I know I've had a couple of suggestions so far, but we're really looking for sort of with Anna's guidance really, you know, the workplace is really key as to managing infections. You know, some of us, I'm one of the working from home people, but you know, I've got really strict protocol if I do enter a building just to film. And we did this quite successfully in Rotherham. We went to a foundry where clearly you can't do that from your back bedroom or your kitchen table, you have to go to work. So I know we're looking at sort of talking to environmental health about a workplace, but is there anybody out there that does go out to work, that does want to talk to us about, you know, things you might have to do differently? Do you have to shower at work and have a change of clothes in the car, or have a bath as soon as you get in, that sort of thing? Do you worry about the children going back to school yet again and the mixing becoming a bit more problematic because social distancing isn't as hands-on as it used to be? Are you all suffering from lockdown fatigue? You know, all of these things sort of play a part, but it's very much couched in the idea that, you know, the team there is doing as much as they can, and you guys in the community are messaging like crazy. So, you know, where are these stubborn rates coming from? So really, it's an invite to say, if somebody wants to be on the telly with me and chat to us about, you know, the realities of taking responsibility in the pandemic and having to sort of keep yourself as safe as possible and the challenges that you've had to overcome to do that, then I'd be really grateful. I don't know if the best way of getting in touch with me, probably via the email. But if you've got any questions now, it's a good time to sort of chat through anything that you'd like to know.
Yeah, just to jump in, that the Rotherham article was really lovely because it really showed kind of the resilience in the Rotherham population and how people were kind of doing things differently. And obviously it's some of the things you've described to us about, you know, the community notice boards, or, you know, any actions that you've taken that have helped your local community or other people to be safe, or you know, support kind of resilience, infection control. I think those would be really great, because we often have sort of negative images about, you know, high rates in Wakefield, but actually, you know, we've got incredible examples of where people have, you know, put so much in to ensure their neighbours, friends, family, and it's strangers, people they don't even know, have had a much better experience this last year. So I think anything like that would be great to share.
Yeah, absolutely. As I started, it's definitely not finger pointing and wagging the finger at anybody in Wakefield or anywhere else, because that just doesn't work for me. You know, I'm a long-term producer in television and I know how this works. I think what we want to do is encourage some of the really clever ways of overcoming the challenges that everyone's come up with. When we did Rotherham, we were fairly inundated actually with people saying, I've turned my toddler group into a Facebook toddler group or a Zoom call via coffee or whatever. So we did get a lot of interaction there, and I couldn't put everybody on the telly. So it's a case of really, you know, what can you tell me about on the ground that's working, that's keeping people safe, and what are people saying to you, really?
Thank you. And I know that there's been so many inspiring stories over recent weeks and months. I think there'll be lots of people able to come through. What I would suggest is we've already had some volunteers come forward as part of our email mail out. So it would be really helpful if we could gather all of the people together and send them to you maybe in one go.
That's fantastic. Yeah.
So if people do think they've got an interesting story to tell, whether big or small, if you want to email COVID Community Champions or give myself or Sarah a ring, and then we'll collate all that information and send that through to Leslie, and I think that would be fantastic.
Yeah, and far and wide, I mean, you know, we had 16-year-olds coming to us and wanting to do stuff with social media, and then we had 80-year-olds that wanted to just tell us traditionally over the back fence what they've been up to. So, you know, I'm open to all offers, really. I think it's just a case of, I need you to tell me really what works, because I don't live in Wakefield. I know it's similar, you know, from the conversations I've had with Anna, that it's the similar situation with regards to Rotherham and other pockets in Yorkshire, but you tell me the stories and I'll try and get them on air. I really appreciate your time. Thanks ever so much, everybody.
Thank you, and thank you for taking the time to join our meeting as well. You're really, really welcome. Okay, so we are going to go back to Jenny now and see if we can hear Jenny. Jenny, we can see you. Can we hear you?
I don't know, can you tell me?
Yes, absolutely,
Yeah.
we can hear you. Brilliant. That's great. So Sarah, if we could get those slides back up from Jenny's point of view. I'm afraid we are looking like we're going to go a little bit over time today, because I think we're just due to finish at 1 today, aren't we? So we'll whiz through, but very happy to take some questions, because we haven't had an in-depth session about lateral flow tests for a while. Sarah, do you want to reshare that screen? I know it takes a while to come through sometimes. And Jenny, I wonder if you want to start while that's happening by just introducing yourself.
Yeah, definitely. So my name's Jenny Waddington, and I'm kind of helping to oversee most of the lateral flow testing within the district. So it's a busy old programme, and it changes quite rapidly. So we thought we'd kind of just give a little bit of insight on maybe where you can get a test, which test to get depending on how you're feeling, and sort of the difference between the two tests, and in terms of swabbing and in terms of results. So it's nothing too in-depth really, hopefully more information than anything else. Most of you will hopefully have heard of the term lateral flow. It's really just sort of the quick process test. So ultimately you can get the results within 30 minutes. The lateral flow tests are really used for anybody that hasn't got symptoms, and it's a quick swab of your throat and your nose, or if you're sort of prone to nosebleeds, both sides of where your tonsils are located, to try and get as much bacteria as you can. So we can pop it onto a little device that makes it able to tell you whether you've got any signs of COVID or not. And then next slide, please. But I know, as Anna mentioned, they're not 100% accurate. So they're not really a green light to say, I don't have COVID and I can go out about my normal business and act as if, you know, everything's back to normal within the world. They are just another level of detail to try and mitigate against the transmission. So they should be taken with caution, but ideally if you know a bigger population are using the tests 2 to 3 times a week, then hopefully if there are any transmission streams that we can stop, and we can stop people going to work or going to school or wherever it may be, then we're stopping that spread. So again, the lateral flow ones should only be carried out if you haven't got symptoms. The test for if you have got symptoms is a PCR, which is where it's a little bit, or it is a lot more accurate, and it gets sent away to a lab, and then you get your tests back, your results back via text or email. We'll go into that in a little bit more detail. So there's 2 ways at current to get to lateral flow test. You can either go and collect yourself a home test kit, order yourself a home test kit online, or you can pick them up from libraries, pharmacies, community test sites, schools giving them to children, businesses and workplace are giving them to staff. So there's lots and lots of different ways to get a home test kit. If you're still not comfortable with doing it yourself, then there are 3 community test sites which will come up later that you can still go to. Realistically, the only difference is how you get your results. So you still do the swabbing yourself. At a home test kit, you will do the processing and the results. At a community test site, one of our members of staff will process the test for you, but there's not a great deal that can go wrong after you've collected the DNA. So we've got our sort of site finder map, and that's the website at the top, but we can get that sent out. It's sort of all of our collection places except pharmacies. So 99% of pharmacies have taken up the offer. So if you do bob into a pharmacy, you can pick up a home test kit. But we've sort of implemented this into all of the libraries which are on there, as well as our 3 sites. And if you, on the next slide, please, if you click onto any of those blue dots, it will give you the details of the opening times, where it is, and then you can scroll down and it'll give you an option to book a test. So all the tests at current are appointments. The appointments for an assisted test are in 10-minute slots. The appointments for home collection kits as a 30-minute slot. There is no in-depth information gathered on you to collect that test or to take a test. It's really just a queue management system for us, so that we don't have 100 people all waiting outside the door at 9 o'clock. We can spread those people out throughout the day. Again, you know, avoiding the crowds. So as I mentioned earlier, with the home testing kits, you record your own results. There's a website that you can, on your phone, scan the device, and you tell the website whether it's positive, negative, or void. With the assisted test at the community site, exactly the same process, apart from we scan the device, and you will receive the information via text or email whether that was positive or negative result. If you do the test at home, you do have to, if you get a positive, you do have to take a confirmatory PCR within 48 hours. That is, like I said, sort of the more accurate test. If you test negative on that, then it does cancel out your isolation period, so it's definitely worth doing if you get a positive on your lateral flow. If it's positive, then obviously you still have to remain with your isolation period. If you are symptomatic and you need to get a test, then the government website is where you can book it. But we do have a list of the different sites as well on further down. But really, if you've got any symptoms, please don't turn up for a lateral flow to collect or to have a test. You really do need to go for a PCR if you've got any of the key symptoms at all, which are high temperature, a new or continuous cough, and a loss of smell or taste. So the PCR sites are Waterfront Car Park, the formal Castleford swimming baths, and we do have some mobile testing units, but it's always worth, again, checking on that government website just in case, for whatever reason, businesses are coming back into play, and we are moving bits and bobs around the district at the minute. Any questions?
No questions on lateral flow?
I'm happy with that, that's okay.
Jenny, it's just Emma. Is it worth mentioning that the Waterfront testing site for PCR testing is actually relocating at the moment? So it will be relocating to Kirkgate, is it, or Westgate? I get confused sometimes.
Yeah, I wasn't 100% sure on which one it was moving to, so I swiftly avoided that one. Thank you. I'm not sure, but I guess the Castleford swimming baths would be your best one to pick up in the interim whilst it's moving, wouldn't it?
There's no break in service for Central Wakefield, so it's literally the other one will be open as the Waterfront is still there, and the Waterfront will be dismantled and the other one will still be operating. I'm just going to quickly have a quick look and clarify that, because I get my geography mixed up sometimes.
Great. Thank you, everybody. Okay, so if we can carry on now with the rest of the presentation, and if you do have any more questions, please just give us, please just shout out in the chat bar. I'm just going to whistle stop tour through the rest of the slides now and reshare. So we have. So we're now on to just a quick overview from Neve around the communications campaign, and you should all have received this information via email as well, I think. Is that right, Neve?
It'll be coming after the session today, so it'll be coming out this afternoon. So yeah, just a little quick overview. We'll be sharing the social media assets for the new Let's Keep Going campaign that we've developed at Wakefield Council. So basically just to remind people that obviously as places are reopening, we're putting safety measures in place across towns and the city centre to make sure that places are COVID secure. And that'll obviously continue as the government roadmap eases out of lockdown. And we've gone for some really nice bright colours and nice images as well on this artwork, just to remind people that obviously we're all in it together and we need to keep going to ensure that rates remain low and we can carry on out of the restrictions. So yeah, I'll put together a little toolkit for people to share these on their channels, and I can share them on the WhatsApp as well. But yeah, if people could start sharing those, that would be fantastic. And if you look around your area, if you're from Wakefield, your local area and the city centre as well, we've got signage everywhere. So it's on bus shelters, digital screens, buses, council bin wagons. So yeah, have a look out for it and let me know if you see any.
Thanks, Neve. It's really cheery and bright. Thank you very much for that. And we'd encourage people to keep on sharing. Just a quick reminder about unpaid carers. I'm not sure if there's anyone on the call who's able to speak to this slide, or if I should just cover it. Is there anyone here to speak to it? Okay, so just a quick reminder then, if you're an unpaid carer, please register with Carers Wakefield in order to be able to access your vaccination if you've not already been called for it. And of course, that will give you lots of access to other support services as well. So please do get in touch. There's a real acknowledgement from ourselves and all of our partners about just how much the churches as well as other faith organisations have done so far in COVID, and we'd like to invite any members of Christian churches to come forward for a conversation around COVID and vaccinations, around having conversations with their congregations. The Mayor is hosting that session and it's tomorrow evening between 6 and 7 p.m. online on Zoom, and our Charlie Keith, the Mayor of Wakefield, has done a fantastic short video explaining the benefits of vaccination, so please do give that a watch and a share as well. If you'd like to come to the session and you haven't already had an invite tomorrow, if you just drop us a quick line in the chat bar or email COVID Community Champions, we'll send you the invite through, and we really would appreciate as many people as possible coming along to that meeting if you're a member of any Christian denomination as well. So thank you for that. And I think it's just to me, and maybe to hand back to Anna to say thank you. I've got a quick reminder to say please register to vote because elections are coming up, and just to thank everybody for their time today and remind you that there is a session next week as well if you're able to come to that. Anna, do you have any further words?
I think Anna unfortunately had to leave us early.
Right, okay, sorry. I can't see with sharing my screen. Do you want to wrap us up then, Emma, please?
Yeah, just to thank everyone on Anna's behalf and all of the colleagues here today for your time as always, and hope you enjoy the rest of your week and see you next week.